Yeah, so we embarked on this project now over 3 years ago in collaboration with the European Bone Marrow Transplant Registry, EBMT. And the question basically was how the patients would do if they receive allogeneic transplant using a cord blood versus a mismatched or partially matched unrelated donor transplant when used with post-transplant cyclophosphamide. And this question is very important in current era where many centers have moved away from cord blood transplant because all of us are now using haploidentical related donor with PTCy. However, not everybody has a fully matched or haploidentical related donor, so the choice becomes either using a cord or a mismatched unrelated registry donor. So in this study, we retrospectively analyzed AML patients who received cord blood versus single or more antigenic mismatched unrelated donor graft with post-transplant cyclophosphamide. And what the study basically showed is that, not surprisingly, there was a high risk of non-relapse mortality in the recipient of cord blood transplant compared to mismatched unrelated donor graft. We also saw high risk of graft failure or graft rejection in a cord, almost like 3 times compared to mismatched unrelated. But the surprise finding was even this clinically significant acute and chronic graft-versus-host disease, which is kind of one of the main reasons many transplanters will prefer cord blood graft over unrelated mismatched unrelated graft, is that our study showed with post-transplant cyclophosphamide, the risk of acute grade 2 to 4 graft-versus-host disease and moderate to severe chronic graft-versus-host disease were actually lower compared to cord blood graft. So the final survival outcome showed that if you have an AML patient and if you have to choose mismatched unrelated with PTCy versus cord blood graft, your survival is actually better if you end up using mismatched unrelated graft with PTCy over cord blood graft. And mainly the difference because was high NRM or non-relapse mortality from the cord blood graft recipient.